learned good lessons and challenges in making sure that women beneficiaries are really benefiting from the program. And last but not least, and this is a familiar face, we're going to listen to the experience from Azerbaijan. Let me introduce our panelists. First, we will have Director Gemma Kabuya. She is the National Program Manager of the Pantawait Familia Filipino program at the Department of Social Welfare Development since July 2019. She's a very experienced person because she has government services for about 27 years. Prior to being the National Program Manager of Pantawait, she was the Director of Social Technology Bureau, Director of Policy Development and Planning Bureau, and Regional Director of Field Office Region 3. Director Kabuya has been designing and writing various program tools, concept paper, guidelines, and program with in a numerous aspect. And one good thing which I noticed that she was also drafting the internal rules and regulation of the Pantawait Familia Law, which was enacted, I think it was in April 2009, and she can talk about that. Now, the second speaker we are very familiar with now is Mr. Tariq Mahmoud, who is the Director General for the Benazir Income Support Program, BISP. So, Mr. Tariq Mahmoud is a career civil servant with almost, again, 20 years of experience in the public sector, serving as Director General for cash transfer for the largest social safety net program in Pakistan, which is BIST, since March 2017. As Director General, he oversees stipend payments to more than 5 million female beneficiaries every quarter. During the last 2.5 years, he led the transition of BIST beneficiary to a more secure and transparent biometric verification-based payment mechanism, which we will also hear today. The next speaker will be Director Royani, who is the Director of Social Security for Family Ministry of Social Affairs in Indonesia. So Dr. Royani is the Director since July 2019 of the Family Social Security at the Ministry of Social Affairs. He's currently responsible for scaling up and implementation of one of the Asia's largest conditional cash transfer program, the Family Hope Program, or in Indonesia is Program Keluarga Harapan, PKH. He has been engaged in developing social protection policies, as well as on monitoring and evaluation of the PKH's impact on poverty reduction. In his previous position, Dr. Royani was responsible for planning, budgeting, and reporting as a secretary to the Mossad's General Directorate for Handling of Poor and Vulnerable Population. And the last speaker is a friend of us, is Aziz Haidalov, right? Aziz joined the ADB Southeast Asia Department in 2009 as a young professional. In 2011 to 2017, he continued as a Southeast Asia Department country economist, the public-private partnership specialist, and infrastructure economist. And then since June 2017, Aziz joined Azerbaijan Recent Mission, where he's responsible for the country strategy, operations programming, portfolio management, and country analytics. He's leading the Recent Mission support for Azerbaijan Ministry of Labor and Social Protection, including in a targeted social assistance, social allowance, and alternative pension mechanism. And prior to joining ADB, he was also the World Bank country officer for Tajikistan. So let me call first then Director Gemma to make her presentations on the journey that Pantawait Familia has gone through as one of the most famous cash transfer program in this region.
Thank you very much, Ms. Ayako. A pleasant good afternoon to everyone, our fellow advocates and partners in social protection. Of course, I'm happy to share with you the Philippine experience of the Philippine Conditional Cash Transfer Model, the Pantawid Pamilyang Pilipino Program. After 10 years of implementation, the program was officially institutionalized last April 17, 2019, under Republic Act 11310, or the Act institutionalizing the Pantawid Pamilyang Filipino Program. Yeah, I think this is the good news that the Philippines would like to share with you. The law officially committed Pantawid as the National Poverty Reduction Strategy and the Human Capital Investment Program that provides conditional cash transfer to poor households for a maximum of 7 years to improve the health, nutrition, and education aspects of their lives. The program aims to break the intergenerational cycle of poverty through investment in human capital and improve delivery of basic services to the poor, particularly education, health, nutrition, and early childhood care and development. It promotes gender equality and empowerment of women and children's rights, achieve universal primary education, reduce child mortality and malnutrition, improve maternal health, and ensure healthy lives and promote well-being for all. In order to be eligible for the program, a household shall be one, identified poor by the standard targeting system. 2, they should be located in the cities, municipalities, and barangays selected for Pantawid Pamilya. They should have children 0 to 18 years old or have a pregnant woman at the time of the conduct of household assessment. And 4, willing and able to commit to complying to program conditions. When the program started in 2008, the Pantawid initially catered 300,000 beneficiaries. Yearly, the coverage increased and currently covers all in all is 4,893,346 that were registered as eligible poor households nationwide, out of which a total of 4.124088 are still active and monitored and provided with grants. The program geographical coverage reached 42,045 barangays or village all over the country. Only the province of Batanes and Kalayaan Group Islands are not included. Aside from the regular conditional cash transfer, the program also has a modified conditional cash transfer. The modified CCT caters other vulnerable households not reached by the targeting system. These are poor families who are members of the indigenous households in geographically isolated and disadvantaged areas, homeless street families, and other families in need of special protection. In total, there are 202,238 households under the Philippine Modified Conditional Cash Transfer. As I have mentioned earlier, we already have reached a total of 4.8 million households nationwide. Thus, in terms of scale, the Philippines is next to Brazil and Mexico, fourth in terms of scale by share of population, tied with Mexico and next to Honduras, Colombia, and Brazil. One of the features of the program is that it has a built-in mechanisms to scale up rapidly when disaster strikes. we follow the same conditions for both the regular and modified conditional cash transfer. These conditions includes 85% of 3-year-old to 18 years old children to daycare center, school, deworming of eligible school-age children, 0 to 5 years old must be sent to health facilities. Pregnant women must avail pre- and post-natal checkups, and the childbirth attended by professional service provider, and the parents must attend the monthly family development session. So in terms of compliance rate, we have 93.44% for education, we have 90% for deworming, and 97.87% for 0 to 4 years old children and pregnant women, and 94% for family development sessions. With the passing of the law, the cash grants for education increased for senior high school from 500 pesos to 10 US dollars to 700 pesos or 13 US dollars. For the health grant, it increased from 10 US dollars or 500 pesos to 14 US dollars or 750 pesos, while the rice subsidy remains at 600 pesos. In total, a compliant household with 3 children in high school can receive a maximum of 6,900 pesos or 132 US dollars every pay period, which is equivalent to 2 months. These grants can be received by the beneficiaries either through cash card, mode of payment, or over the counter, both catered by Land Bank of the Philippines or through Land Bank conduits. Cash cards, grantees use cash cards to withdraw grants from automated teller machines or Land Bank and other banks, and over the counter, other financial conduits such as rural banks, cooperatives, and private money remittance service providers conduct the on-site and off-site over-the-counter transaction payouts. The program's unique feature includes the conduct of the family development sessions, which aims to strengthen parenting capabilities of the household grantees for them to be able to be more responsive, responsible, and upholding the rights of their children, preparing children emotionally, socially, physically for them to be motivated to go to school, foster deeper social awareness, and be actively involved in different community development activities, and be socially prepared for their eventual graduation from the program. Sessions includes effective parenting, financial management, and specialized modules such as active citizenship, module on disabilities, module on child labor, drug abuse prevention, disaster preparedness, among others. Another is the conduct of social case management. This is a problem-solving process used by the social workers or the community facilitators. This is a scientific approach to capacitate family to perform their roles, helping the family to identify and solve their problem with the presence of a case manager or a social worker to conduct home visits and likewise track the progress of our poor households. To assess the level of well-being of beneficiaries, which will be the basis in identifying the appropriate interventions using the social welfare and development indicators as a tool developed by the Department of Social Welfare and Development. So of the 10 years experience, we have encountered the following challenges. 1, the cleansing of database. Since 2018, the field offices conduct massive validation of household to address data inconsistencies or duplicates, as well as updating of the household roster. Second, the heavy caseload of city municipal link, the case managers, which has an average of 800 caseload of households. The number was way beyond efficiency level that they can handle, considering that they also assist the other programs of the DSWD, such as the unconditional cash transfer and social pension. But currently, there is an ongoing negotiation with the Department of Budget and Management for additional staff complement to lessen the load of our municipal links. Another major challenge is the delayed payouts. This happens specifically to over-the-counter payments. The Land Bank of the Philippines often experience problems in procuring conduits who shall conduct the actual payouts, especially in geographically isolated and disadvantaged areas. Fourth, conversion of cash card to savings account. The program have an initiatives to convert all cash card to savings account. With this initiative, the DSWD can avoid findings from our Commission on Audit, citing that our beneficiaries don't need the grants since they don't have any transaction for a long time. Last challenge, coordination mechanism and integration of Pantawid Pamilya Information System. The SWD, our organization, acknowledges the need to streamline and integrate program processes together with other government agencies, especially the supply side agencies, to reduce errors, make transactions faster, and improve accountability with other primary partners, particularly the Department of Health, the Department of Education, and we're happy that ADB is supporting this initiative. So another challenge which I have not indicated in my PowerPoint presentation, of course, we are now coming up with a graduation strategy for our Pantawid, and we are hoping that we also work with you to get some support from our partners. So that ends my presentation. Thank you very much.
Thank you very much, Director Gemma. Can we now call upon Mr. Tariq Mahmood to make his presentation? Thank you.
Bismillah ar-Rahman ar-Rahim. Distinguished delegates, ladies and gentlemen, I will be presenting Benazir Income Support Program's lessons and experiences relating to targeted unconditional cash transfers, because that is the core of our program at Pakistan. A few slides will be a repetition of what I presented yesterday, so you have to bear with me on this. Sequence of presentation is as flashed. Benazir Income Support Program is administratively part of Poverty Alleviation and Social Safety Net Division, and it is programmatically aligned to the government's agenda under the Prime Minister's Ehsaas program, which was launched in March 2019. As I said, core of the program is the unconditional cash transfer, which serves more than 5 million beneficiaries, female beneficiaries. And conditional cash transfers go hand in hand, which include Wasila-e-Taaleem program. Currently, 3.2 million children of beneficiary families are enrolled in the Wasila-e-Taaleem program. We are also piloting nutrition program for the pregnant and lactating beneficiary families, mothers. The unconditional cash transfers are aligned to the goals of SDGs 1 and 2 and also the part of BIS Pact. The heart of cash transfers is the targeting system. In yesterday's presentation, I was also asked to make a special reference to the targeting system. We conducted a nationwide socioeconomic survey in 2010-11, through which we surveyed about 27 million households, and as a result of this survey, 7.7 million female beneficiaries were identified as, this is a typo mistake, 7.7 million females were identified as potential beneficiaries. Thereafter, we applied a proxy means test and identified a cutoff score of 16.17. The eligibility criteria was defined as an ever married female with a valid computerized national identity card falling within the PMT cutoff score of 16.17. Then there is a secondary criteria of appeals criteria which relaxes this main criteria. We go from 16.18 to 20 and relax this criteria for elderly women of 65 years or above age. We also relax this criteria for if there is a disabled member in the family, and if the household has 4 or more children in that household. So the criteria is relaxed between this PMT. Then there is another relaxation from 20.1 to 25 PMT score if you have 2 differently abled persons in your family. We have evolved in terms of payment systems. We have learned from our lessons. Firstly, we initiated payouts through Pakistan Post money order system in 2008. But learning from the issues of money order payment mechanism, we piloted smart card and mobile banking in 2010. But there were also issues with these payment instruments, so we rolled out debit cards through banking channels, and in 2012, and for the 4 or 5 years, we primarily issued payouts through the debit cards. In 2016, we started with a biometric verification system, and till date, we have 90% of the beneficiaries converted to biometric verification system based withdrawal mechanism, and in total, 115 districts are now converted to biometric verification system. And this is beneficiaries' feedback. I think I should skip this because of the shortage of time. Okay, this was also discussed yesterday. BIS targeting and eligibility criteria has enabled social and financial inclusion of more than 5 million unbanked women and also made them part of the electoral process. Quarterly cash grant has significantly been increased, and that shows the consensus of the political governments over the period of time. We had 3 different political parties, and despite that fact, the program has continued. And this is one of the positive features of this program, that despite the political differentiation, the quarterly cash grant has also increased, and also the annual budgetary allocations for BIS program has increased multifold during the last 10 years. There are positive impacts as per the impact evaluations conducted by the Oxford Policy Management. As mentioned, 98.5% of the payments are being made through electronic payment modes, which is 90% BVS, 8.5% through debit card, and remaining through Pakistan Post. We have dispersed till date rupees 709 billion, which is approximately equal to $7 billion. We have an effective payments grievance redressal system. And we have also developed evidences for policy review and revisions in payment systems. Some of the major findings of the impact evaluation are highlighted. This was also mentioned in the yesterday's presentation. The cash transfers have reduced malnutrition. They have increased monthly consumption expenditure. 76% of the beneficiary women have full control over cash. There are positive impact on the school enrollment of the beneficiary child, and there is increased willingness of women to vote. The future policy interventions in terms of UCT are implementation of new biometric verification system or solution through new banking contracts, extending UCT benefits to more beneficiaries as per the vision of the Prime Minister. Also expanding conditional cash transfers, this is Wasila Talim to 50 more districts. Currently it is in 50 districts, and by 2022 we plan to expand Wasila Talim to the entire country. Also piloting nutrition for the lactating and pregnant mothers, and increasing partnerships with other programs at the federal level and provincial level, and institutions including private sector institutions and CSOs under the SAS program. Thank you very much.
So now may I ask Director Royani to make his presentation? Thank you.
Good afternoon, everyone. Thank you very much to be a part of lightning talk with a great panelist. Conditional cash transfer in Indonesia, known as Program Keluarga Harapan or PKH, or you can call it Family Hope Program, managed by Ministry of Social Affairs of Republic Indonesia, started in 2007. Nowadays, PKH become one of national program and epicenter for referral of beneficiaries to complementary social assistance program. All beneficiaries of PKH must receive benefit from other social assistance, such as national education card, health insurance, non-cash food, etc. Since target of PKH 20%, the poorest of 40% poorest in unified database. In the initial year, PKH focused on access to health and education services than 2017. Included social welfare component, which are elderly and severe disability as the target group. Currently, has coverage 10 million beneficiaries, spend of 2.4 billion USD. Average of benefit for social family depend on the member number of family maximum 63.44 up to maximum 676.68 per year. As you can see here, coverage and budget from 2007 until 2019 continuous increase in such significant way, especially at last 5 years between 2015 and 2019. Why government continue increase coverage and budget of Program Keluarga Harapan or PKH? PKH has a significant direct impact on poverty and gap reduction. This program effectively reduced number of poverty rate as released by the Central Bureau of Statistics Republic of Indonesia. That number of poor people in March 2019 about 9.51%. Despite number of achievement of PKH, there is still space for improvement. First, PKH has succeeded to transform delivery of payment from cash to cashless. The next challenge is how to improve convenience beneficiaries to cash out of benefit from several channels such as outlet, ATM, and agent. For beneficiaries who live in hard-to-reach area, geography, lack of infrastructure, PKH still looking for several innovation and services. PKH initially was only implemented in the location that the supply side of education and health services was ready. Since 2017, the program, PKH, has proactively been reaching out the remote and isolated areas in Papua, West Papua, and other provinces. A separate operation model PKH Access was introduced for this difficult area. PKH program needs to collaborate with subnational government in the improvement of supply side. Second, the poor and vulnerable beneficiaries need not only cash benefit to support basic living standard, but also knowledge and relevant life skill to the critical aspects such as maternal, child health, nutrition, parenting, and household finance management. Family development session is the right instrument, but its performance in terms of beneficiary behavior change need to be monitored and evaluated. PKH beneficiaries overwhelmingly want rather to be self-sustained than being recipient of cash benefit permanently. However, they often need additional assistance beyond financial support to become reasonably productive and resilient to various shocks. PKH is facilitating its beneficiaries to access to both government microcredit program and e-commerce player. Third, strengthening PKH management is manage the increasement 10 million beneficiaries to provide comprehensive data on population such as ID number, place and date of birth, mother name with related to KYC, and additional information to get a picture on social economic status. APKH can use by the facilitator using mobile phone, Android, and web-based application. In the future, APKH will feed and share data to support other social welfare means programs such as 6NG, education assistance, and health insurance. Fourth, as I mentioned earlier, with the increasing of the beneficiaries with nationwide coverage of 34 provinces and 512 districts, PKH need to have number of human resources to support PKH business process. Each level contribute to PKH success. Every 100 to 150 beneficiaries is sub-district level is facilitated by one facilitator who rules to ensure beneficiaries compliant and follow family development session. So in this opportunity, we would like thank you to ADB to start working together with us at early 2018 on three output. One, capacity of selected PKH implement improvement. Second, PKH implementation is disadvantage areas strengthened. Third, analytical, communication, and advocacy skill of MOSA staff enhanced. All these three output in line to address all the challenge. Thank you very much.
Thank you very much, Director Royani. So now may I ask Aziz to make his presentation? Thank you.
Thank you. Don't start counting yet. Anyway, so colleagues, in comparison to Philippines, Indonesia, and Pakistan programs, Azerbaijan's program is more humble in terms of the number of beneficiaries. Of course, these countries are have much more population than Azerbaijan. Nevertheless, the targeted social assistance program in Azerbaijan plays a very critical role, and I'll try to provide you the highlights why it plays a prominent role in country social protection system. Now you can start counting. So country context, how do I click? Does it go automatically? Can you go to the next, here? You see, I'm using the time now. Where do I click? I have no idea. How do I click? Oh, sorry. So country context, Azerbaijan is an upper middle income country which has undergone significant, dramatic in positive terms, transformation since regaining independence in 1991. The poverty dynamics, as you see on the slide, are very positive. Inequality dynamics are very positive. This is an important factor of this is because of the important role that social protection and social transfers have played, as well as the dramatic rise in the real wages. This all has its source of funding. Everything has to be paid from somewhere, and as you may know, Azerbaijan is a resource-rich country, oil producer. So that has enabled the government to significantly invest and provide a huge amount of social transfers to the population. That led to this very positive dynamics. At the same time, challenges remain. There is high degree of vulnerability in case of shocks, such as catastrophic health expenditures. There is also high inequality of opportunity, as well as regional inequality. In this year, the government has introduced very important measures. Basically, on the first two bullet points of the slide, you can see that for the first time in the history of the country, the minimum wage and the minimum pension have now been set above the minimum cost of living. And the TSA coverage, the targeted social assistance coverage, is expected to increase to about 100,000 households in next year. I will not dwell much on this slide. Maybe I'll go to this one, to the next one. It's now, after the country context, I would like just to present the place the TSA has in the social protection systems of the country. You can see that it's a central place, in particular in the welfare assistance part of the social protection system. And TSA, like in Pakistan, is unconditional. At the same time, it is application and filter based. And if you pay attention to in the social assistance column, you can see that Azerbaijan has also a quite comprehensive system of social allowances. There are about 27, it depends how you count them, there are about 30 types of social allowances. And this has been increasing recently because of reasons that I will explain later. The TSA has been established by law, so unlike in the Philippines where the institutionalization happened later in the implementation, in Azerbaijan the law was established and then rolled out in 2005. Over the years the number of beneficiaries has peaked, but then since 2015 the number of beneficiaries has been going down. Why, again, I will say in the next slide. I want to keep you intrigued. What is TSA? TSA is anchored on assessment of the needs criterion against the income of the household. At the same time, there are filters. So if one of the filters, such as, for instance, cost of mobile, exceeds 10% of living minimum, and even though you are still poor, you may not be getting the TSA, and that's another problem that leads to the high exclusion error that is shown there. Now, the government has thought about how to address the chronic reliance on TSA, and they have introduced the so-called activation component. It means to help certain TSA recipients, those who are likely to be, likely to have business prospects, they are enrolled in a self-employment program in the activation component, and they receive certain support. It's assets basically, but at the same time, it's unclear how important that activation component is, because it can lead to certain level of displacements and dead weight. And then what I wanted to mention, why TSA budget has been going down and social allowances budget has been increasing, is because of the last bullet point, is because of the perception of misuse of official rent seeking to help the applicants qualify and then confirm eligibility. And this is what the government is trying now to address. What are the possible ways forward? Now, this is, in the short term, this is already being tackled, and we are very honored that we had a humble contribution to this, to inform the government's decisions, such as simplification of the filters, so that to reduce the exclusion error. Second is to improve the transparency of the TSA, to basically regain the confidence of the government by considering establishment of third-party independent validation framework, and then also to bring the needs criterion up to the living minimum. I don't want to dwell on the activation. On the medium term, over the medium term, maybe the most important part is in terms of targeting, and this is going into introducing some conditionality into the TSA. Unfortunately, despite all the positive dynamics, there is some child health issue. In particular, stunting among the poor is high, so this could be considered over the medium term as something that TSA could contribute to. And gradually, when the confidence and the governance arrangements improve, then government could consider and phasing in categorical allowances into the enhanced TSA. Let me stop here. This thing is red, so I need to close my speech. Thank you very much, and happy to answer your questions.
Thank you very much. Thank you very much for all the presentators. So you heard a very rich experience from 4 countries' experience. And as you know, it's each presenter was given just 7 minutes to present on such a broad and complex program. And it's a never-ending program because, as you know, when you are now engaging in poverty reductions, you want to make impact on the beneficiaries, you want to address the increasing complex needs. It's a never-ending story. And I think a few years ago, when we were talking to the former secretary of DSWD, the Department of Social Welfare in the Philippines, she was mentioning that it's not that the devil's in the detail, it's the angels is in the detail. So I think we would like to hear a little bit more of what is really the implementation challenges and maybe the good lessons or maybe good practices that we can share with everyone. Now, the questions are coming from the floor, so let me take some of these. Okay, let me take the first one. Many children with disabilities could not attend schools because schools lack the capacity to provide them quality education. How was this program helping this household to comply with the condition? I think this is really when the program has some conditions to the targeted cash program. I think maybe we can also relate to maybe another question that has come a few more times in the previous discussions on. Then first is really the inclusion aspect. The second is, as we said at the beginning, cash transfer is one. It's really how you coordinate with the supply side, right? How is the education services are providing the good services to the beneficiaries? How you also partner with the local governments and so on. So maybe in that sense, I think it's a common issue. So I guess if we combine these questions into 2, maybe one lessons learned when it comes to the particular question was children with disabilities, but you may also refer to children or families that have specific needs. And then how do you collaborate with the oversight agencies or the cooperating agencies to deal with that problem? So maybe Director Jem, I know she has a lot of lessons to learn to share with us. So.
Thank you very much. In terms of accessing our children with disabilities, not for the education program, the Philippine Pantawid has this National Advisory Council It's a national interagency mechanism who provides the services or the supply side such as education and health. No? And in that mechanism, we have some inventory of schools in different places nationwide, and then we identify where children with disabilities and what intervention. If we don't have a formal school, they have this alternative learning program for children with disabilities. So we work within the program of convergence. So we are coming up with one data sharing. So we have to share the data to all our partners so that they can now identify the appropriate interventions, of course, the budget that needs to be provided to our households.
Anyone would like to answer the same question?
It's okay now. Hello. In Pakistan, we do have many institutions who are providing benefits to the differently abled families, particularly differently abled children, and providing them with stipends to go to school. But yes, the question is very pertinent, and we have a long way to go in addressing the gaps in the school system in which a differently abled child has a progressive environment for study. At BESP, what we do is we have a criteria, as I mentioned in my presentation, in which we identify any member of the household with a disability. We relax the criteria, and we encourage them to come to the main, to be eligible for the BESP grant. There are students with disabilities which we provide cash grants, but the number is not that much. But under the SAS framework, we are trying to address particularly marginalized and excluded population, and including those with disabilities and students with disabilities in particular. And we hope in future, with the long-term vision of the Prime Minister under the SAS program, we will be able to cover this gap that is existing right now in the system. Thank you.
Thank you very much. Director Yoani, you would like to share something? Disability or yes?
Yeah. The new component in Family Hope Program in Indonesia, PKH, is disability. Conditionality for disability is soft conditionality. Mean the family who have disability in this family allowed to access depend on current facility in the area, and every family have a disability have facilitator to have children with disability, and family development session allowed and encourage supply side Ministry of Education to enhance the services family. I think that.
Thank you. Aziz, something to add or?
Is it working? Yeah. Just wanted to add that benefits for the disabled are also obviously available in Azerbaijan, though they are not part of the TSA, which is welfare assistance purely. The disability assistance is through the system of social allowances. And one of our recommendations over the medium term is to gradually, while improving the governance of the TSA and regaining the confidence of the government in the TSA systems, so that the disability benefits are also mainstream gradually into the TSA, into the enhanced TSA. Thank you.
Thank you. I think the next question is for the Philippines, but I think this is a question applies to any program when it comes to targeting, right? can you share how the system was improved to reduce both exclusion and inclusion error? It's also as a kind of never-ending sort of challenges, right, to tackle this issue. So maybe we could start from Director Gemma.
Okay, thank you. As I've mentioned in my sharing, this is one of the challenges that we have been encountering. For the inclusion error, we developed the grievance redress mechanisms, from the local level to the provincial, to the regional, and to the national level. And then our staff from the different levels conducts validation to the households. And for the exclusion, we have the on-demand application. But first, they should be part of the national household targeting system, or the listahanan, what we called. Then they can approach our offices at the local levels for the on-demand application, as long that they are part of the listahanan. So the listahanan is primarily our database of who and where the poor are in the Philippines.
Thank you. And I understand there's a new listahanan now being conducted, and to have a revised list of the beneficiaries in the Philippines. Aziz, you mentioned that one of the challenges now in Azerbaijan is how to reduce the exclusions error, right? Is there anything that you are hearing from the Philippines, or is there anything more that you want to share, or even ask even the BISP or the PKH program also to share with you?
There are many aspects many interesting aspects in the Philippines, Indonesia, and Pakistan. In terms of the exclusion error, one dimension that I wanted to mention, and it's not necessarily linked to Azerbaijan. I think I found that by getting acquainted with various countries, is that sometimes the exclusion error is, to some extent, is deliberately designed into the system so that the scope of the social assistance does not unnecessarily expand and becomes too much of a burden to the budget. Some countries may have introduced this so that to some extent also reduce the appetite of the relevant agencies for the more and more budget. So this is like a political economy dimension to the exclusion error. At the same time, in Azerbaijan, what is being done is to simplify the filters, which may unnecessarily reject those who actually are eligible for TSA. And the exclusion error is pretty high. I don't want to quote the numbers, but it is pretty high, and it's of concern to the government. So this this unnecessary filters that are burden to the applicants are being reduced so that the TSA can actually target and exclusion error can be reduced.
Okay, thank you very much. To me, the way I understand is that whether to decide, there's a certain policy decisions that needs to be made. So what is most important? Is it to make sure that everyone is included, or is the other way around? I think it's really a very difficult decision to be made from the policy makers. Now, the next two questions are for you, Mr. DG Tariq. One question is that many children are out of school in Pakistan, so has there been any pressure from any side to put education conditions, or is there any other major being employed? The second question is, this includes both unconditional and conditional transfer. So what's the difference? How you make the difference between the two?
For the first question, education is a devolved subject in Pakistan, like the health sector. Provincial governments are totally empowered. They have the separate budget for their education, and usually in all the provincial governments, the primary education is free. What BISP is doing through the conditional cash transfer, that is Wasila Taaleem, is paying cash outs to the children of the beneficiaries who are the poorest of the poor, and encouraging them to go to school. And these are mostly out of school children. And through this endeavor, they have, BISP has ensured almost 3.2 million out of school children to go to school. Besides that, we are also, through impact evaluation, what we have seen is that in the Wasila Taaleem district, there are better retention of the children in primary education as compared to those districts where Wasila Taaleem is not being funded. So there is a comparison. We have done that, and we have seen that there is a significant impact in terms of BIS stipend going to the beneficiary household to encourage their children to go to schools, primary schools, vis-a-vis the primary school education of the provincial governments, where there is lesser retention in the primary school level. To the second question, basically the targeting and the eligibility criteria is based on the UCT. It's an ever married female, and she is the mother. And the mother, then the children of that female are eligible for conditional cash transfer, which is the Wasila Taaleem in our case. So this goes hand in hand. The only thing that varies is the age criteria, which is 4 to 12 years or 5 to 12 years in the case of Wasila Taaleem. The stipend amount is almost 750 rupees per quarter, or equivalent to $4.3 per month.
Yeah, thank you very much. And you're answering partially the next question, which is actually addressed to all presenters. How were the cash transfer benefit amounts set, and are they adequate? Director Gemma presented that there was an increase of the cash transfer benefit amount. That was actually a very positive policy decision from the government of the Philippines. So maybe a little bit on that for all presentators. It's a difficult questions, because you want to, there's more needs, so you want to expand the beneficiaries, because maybe more beneficiaries are needing support. At the same time, you also want to increase the benefit level, but then how you put it in one, the resources is also limited. So again, it's a very difficult policy decisions that each government has to take. So maybe a little bit on that struggle on what is the right benefit level, and are they really adequate for each beneficiaries? Maybe I can start from the end. Yes, from you.
That's a very tricky question. It has both the social and fiscal dimension, and they need to converge eventually. In Azerbaijan, the needs criterion, which is the threshold for the TSA, is established to some extent administratively based on certain pattern of consumption, how many calories, etc. So like a poverty line. And one can argue whether that is an adequate reflection of the need or it is not. There are some suggestions for Azerbaijan that it should be based on a survey, so it should not be necessarily administratively set and legislated, by the way, every year as part of the state budget. But country systems, country statistical systems, country economic planning systems need to be also adjusted to enable that approach. Currently in Azerbaijan, it is administratively set. and legislated every year in the state budget. I'm repeating myself just to make sure that it's very clear. This is in terms of how it is defined. At the same time, there is a fiscal dimension to that. How much does the government, can the government afford? Because you can raise the needs criterion to a very comfortable level, but then how much fiscal space you have for that. So it's a compromise that needs to be achieved between the social dimension and the fiscal capacity dimension. Azerbaijan may be in a favorable situation because it's an oil-rich and the consolidated deficit is in surplus, so it may have that fiscal space, but other countries may not have that fiscal space. That's why this compromise between the social and fiscal dimension need to be done. Thank you.
Any experience to share from PKH?
Yeah, in Indonesia, PKH setting amount, benefit amount for family depend on the number of family. The maximum number is 4. So the amount of benefit based on minimum consumption of poverty line. And based on number of family, maximum 4 member each family who eligible. The size of benefit count based on number to family maximum member of each family. Thank you.
The cash grant is based on the consumption pattern, but it's annually adjusted to the inflation rates in Pakistan. Coming to the question whether they are sufficient, I don't think they are sufficient, but then again it depends upon the availability of the budget that the government has. So the question is really the availability of the fiscal space with the government, because the number of beneficiaries is large and there are other sectors of the economy which also require the resources.
Yeah, for in the Philippines, I think this is one of the new provisions of the law that the cash has been increased, no, all in a little amount. But I think there is something that we have still to study, no, and how does it affect to the consumption of the family, if it increased food consumption or not, something that we have to look forward.
Okay, thank you very much. Next question, I think it's addressed to I'll take the second question first. It addressed to the Philippines, but I think it's something that's probably it's also relevant to other countries. So in the Pantawid Philippines, can you expand on the program mechanism for expansion in case there's a disaster? As we know, Philippines, unfortunately, is prone to a lot of natural disasters. So how a system like Pantawid Familia can also address the casualties and needs of the families in case of disasters? Is any mechanism embedded there? What about PKH? What about APSP? What about any consideration in Azerbaijan? And I think there's something which is, I don't know if it's related. Question, is it horizontally more beneficiary or vertically more to the existing beneficiary? I think it's related to the previous questions on the benefit level. So why don't we answer the questions on is there any mechanism in case there's a disaster?
Yeah. In our, before the law, the Philippine Pantawid Familia has a modified conditional cash. This is addressed to other vulnerable groups. And this includes those who are victims of disasters, no, and the homeless, and those who are living in geographically isolated areas. And now in the new law, it's again emphasized. But as long that they are automatically be reached out as part of the targeting system. So they are immediately be reached out. For example, in where is the disaster-prone area in the Philippines? So the survey now, the listahanan is done every 3 years. So this year we will be having our third listahanan. So in the law, the disaster-prone areas in the Philippines is automatically part at the area to be covered. Yeah.
In case of Pakistan, we have two major categories which afflict this part of the country, is the earthquake and floods. We have a National Disaster Management Authority, and we have PDMAs, Provincial Disaster Management Authorities, with their separate budget to handle any such event, any such disaster or any catastrophe that happens. In case of APSP, we do have, we do provide cash for disaster management and also for in case of any catastrophe. In the past, we have done for flood emergency and also for earthquake. But that comes with the directions at the higher level, and we do horizontally as well as vertically as well, because we have the database. And through the database, we can identify those individuals who have been affected in those areas who have been hit by a disaster. This has been shared with NDMA as well, and also in case the BISP type cash grant is required, that is also provided. We have also this institutional strength that we have tehsil offices in the entire country, almost 400 tehsil offices. So from the headquarter to the tehsil level, we have well coordination in case of any such, if there is any demand for cash disbursement during the any sort of disaster or emergency situation.
Any experience from Indonesia?
We have adaptive social protection. This is the way how to make the become beneficiaries by simplifying from the regular business. When disaster happen, our facilitator identify the victim and quick assessment to know their needs.
As far as I know, the TSA of Azerbaijan is not linked to a disaster relief function, and luckily there were no major disasters, so we are, glad on that. We're lucky on that side, but potentially because of the targeting mechanism, in case of a disaster, and this would be mostly in terms of earthquakes, possibly not unlike storms and other frequently and high impact disasters that Philippines and Indonesia are prone to. That would be, so that the targeted beneficiaries could be quickly identified to approach them for relief and for assistance in case of a disaster. But now it is not linked. And Sabina, my colleague, is here. I think, am I right? It's not linked to a disaster. Yeah. Thank you.
All right, thank you. There's another question that I'm sure everybody is doing cash transfer program is facing. What's your sense of how popular these poverty-targeted programs are among those who don't receive them? So it's really how to manage also on the sense of maybe my neighbors are receiving them, why not me? Do you think that these targeted programs, do they see them as necessary or drain on resources? It's really about public, is a consensus about the need for this poverty-targeted program. How do you manage those who see them as, it's a drain on resources? Maybe in a countries like Philippines, now, Indonesia, Pakistan, because now it's been so, institutionalized, accepted. Maybe there's maybe less of a problem, but I'm seeing the long journey towards that stage. Then, is there any lessons, any experience that you would like to share?
I would like to refer to the question that was raised by the Sri Lankan colleague yesterday in the presentation, and that was regarding dependency syndrome. And this is a perception issue. We face this on a daily basis in the newspapers or in a high society meeting, that you have created a dependency syndrome. But when you go to the ground and when you see the beneficiaries, which are the poorest of the poor, and that is where the evidence is required, and where the proper communication and proper coverage of this, how you are dealing with the poorest of the poor needs to be highlighted at the national level, provincial level, so that the people who are not accustomed to seeing such people in their daily lives should be made aware that there is depravity in the society which they have not encountered, and that needs to be publicized in that manner. So I don't see them as a drain on resources. This is a necessity as long as you take other initiatives in consultation with the other federal interventions, provincial interventions, so there is coherence and there is a well-aligned strategy for poverty reduction and elevation of, and bring these people out of poverty trap.
Yeah, and for the Pantawid Pamilya, the program has been there for 10 years, and there have been impact studies that says that this is an effective program. But what the challenge now is really how to monitor, in the monitoring of if they have their conditions or economic conditions have been improving or not. So that's something that now that the law is there and it has been recognized by the government as one of the poverty reduction program, we have to come up with some monitoring tools at the household level and coming up with really some exit or graduation strategy from the program. Thank you.
Any experience from Indonesia? How do you deal with this sense? Yeah.
Okay. In Indonesia, we use unified database to targeting of the which household can give the program Keluarga Harapan, and the local government must be updating the data. So we have update data to targeting for program Keluarga Harapan in 1 year. This everything for local government.
There was an earlier question about child labor. Now, yes, so how a target cash transfer program such as yours could address issue of child labor? Do you think that it should be one of the conditionality, or is there any program that can deal with that? So, Director Gemma?
Yeah. First, it is one of the conditionalities that children should be sent to school. And this is part of our family development sessions, really to educate and the parents on the rights of the children. So because child labor is primarily a child protection issue, and of course we refer or we provide livelihood. We prioritize. In the law now, it says that Pantawid Pamilya should be prioritized in terms of the provision of livelihood and economic activities. So this is one of the maybe reasons to help reduce child labor. Thank you.
As per law, child labor is not allowed in Pakistan, but there are economic conditions which prompt the families to send their children to work at a younger age. What we have experienced in the Wasila Talim conditional cash transfer is that there are dropout rates because of this, and because of the pressures, economic pressures. The only way out is to increase the incentive structure for conditional cash transfer and encourage the parents to retain their kids in school. And this can, one of the ways to do that is to increase and incentivize them by increasing the cash transfer for their children, to encourage them to go to school and also to learn vocational training. Thanks.
Any other sharing on that issue? No? Okay. It's not really maybe related directly to child labor, but I know that now Pantawid Familia, aside the family development session, you have what we call a youth development session, where probably any sort of challenges, anything related to youth, maybe being addressed there. So I was wondering whether in some other programs also, is there any things that targeting needs particularly to youth? Is that for, as you say, vocational training? Is it career? Is it about health-related issues? Is it about relationship issues? Is there anything that is worth mentioning about youth?
The particular question about the intra-household relationship issues, these we address, we have been receiving through grievance redressal mechanism. We have been receiving queries and questions either written or through President Office or Prime Minister Office that they are excluded from the system. And the neighbor within a vicinity is receiving a cash grant, or their kids are receiving cash grants, so we are missed out. So there are evidences of exclusion errors in the survey, so this is a targeting matter. But this is an informal sort of evidence that we receive through this grievance redressal mechanism, which we either through Prime Minister's portal or through the letters we receive directly to our minister or to our secretary or through the President's office or the Prime Minister's office, that this is a tension. Yes, this is a tension where the people who have been left out earlier are highlighting that they are left out. But a formal evaluation study in this regard has not been made, but this we have come to know through the grievance redressal mechanism that we have in place.
Thank you very much. I think we are, yes, coming to the end. There's a more global questions on whether, yesterday we talked about that the spending on social protections has increased from 2009 to 2015. Is still low in Asia and the Pacific compared to the global average. And here we're talking about social protection program, and here now we're more focused on social assistance. But nevertheless, maybe I can ask maybe each of the discussant here to tell us, for instance, if there's more spending to be made, there's more increase in your budget for the cash transfer program, what would you prioritize? I think that's really, what would you prioritize? And is there any other, now, without also more funding, what is really crucial to do? What is the next step to improve either the targeting? Is it about the evaluation part, which is also very important when the questions came about, are other people happy about the poverty targeted program? Are we showing enough impact of this cash transfer program for poverty reductions, for instance. That could be another one. It could be on discussions around, is it a more exclusion to reduce the exclusion error, or making sure that the inclusions errors are not there? So it's, again, pros and cons on expanding the number of beneficiaries. Is it the benefit level? I think it's a lot of struggle around that. But now, if you have more budget, let's say, what would you prioritize? Or what is the next actions that you want to take in order to, let's say, increase efficiency on the spending, more impact to your beneficiaries, and so on? So maybe, who can start? Maybe again, can I start from there? Yes, Aziz.
It's not advisable to sit on the end. Sometimes you're prompted to start. If there was more budget, and luckily in Azerbaijan we have that pattern, so the government is now putting much more budget to social protection. As I mentioned in my, I think, slide number 1, there are two key issues with Azerbaijan's social protection system in general. One is that the coverage is low, especially in active labor market programs. If you go to the publication that was done by SDCC recently on this fiscal space for social protection, it's almost about 0% of GDP per capita, as well as pro-poorness of the social protection. So if there was more budget, I would put more money to the active labor market programs and link them effectively with the TSA, with the targeted social assistance, to effectively target this chronic reliance and the impression among the society that you are perpetuating actually the poverty by this cash transfer systems. And second is, if I had more budget, I would put that into the TSA. I would reduce the social allowances, because administrative cost of social allowances in Azerbaijan, if you go to my slide number, whatever, there is a table there. There are 30 types of social allowances, and they very often overlap. There is a lot of inefficiency there. So I would reallocate the budget from social allowances to the TSA, but at the same time, do two things with the TSA. I would raise up the needs criterion to the minimum living cost, so that it becomes more tangible for the beneficiaries, and I would improve the governance arrangement so that the people don't perceive that as a rent-seeking type of opportunity. Have I? Okay.
Royani, what will be your priority?
Okay.
If you have more budget, any actions you want to take?
Now in Indonesia, social protection budget is fifth rank in national budget. PKH coverage and budget from 2007 until 2029 continues increase in such significant way. So social protection budget now is fifth rank in national budget in Indonesia. Thank you.
We have already, the government has announced, we have significant increase in the budget, so that's beside the point. Given the priority, I would focus the priority first on the targeting system. We need to have a new survey on ground so that we have realistic measure after 10 years on how many are now included and how many are excluded from the system. The second would be to improve the payment systems as much as possible, bringing in more transparency in the system. Third is strengthening the beneficiary outreach and communication so that they are more aware of their rights. And fourthly, encouraging CCTs, expansion of CCTs, and also the graduation approaches. Thanks.
For the Pantawid Pamilya, so we're saying that we really need to, at the household level, more labor market or livelihood activities, likewise some insurance for health insurance, no, for our beneficiaries. And one of the problem now with the Pantawid is the lack of the staff at the ground level to really monitor or visits, no, our household beneficiaries. Thank you.
Thank you very much. Obviously, the capacities of the implementers and facilitators is very important. As you increase, as needs are more complex, and you really also want to make sure that the lot of expectations coming to this cash transfer program are really sort of implemented, and you get the result from the field, right? So again and again, it's a long journey. Once you are into poverty reductions, you want to do something for the beneficiaries. It's a never ending stories, and really the angels are in the details. And we got a glimpse of the experiences, the implementation challenges. I do hope that it was useful for everyone to think about again on how you make this cash transfer program even more efficient, even more, friendly to what we intend to achieve for the individual, for the society and the countries. So please join me in thanking our discussants for really sharing this such a rich experience on the targeted cash transfer program.
So we'll have a short break, and please resume at 3:30. Thank you.